What's up everyone, this is Greg with sportsrehabexpert.com. Today we're going to be talking a little bit about patellar tendinitis. Some people like to also refer to this as jumper's knee. And if you really want to get technical about it, it could also be referred as patellar tendinosis. The difference between patellar tendinitis and tendinosis is itis means an acute inflammatory situation where you just injured the tendon and there's a lot of very touchy pain that is very, very sensitive, sharp, localized, pinpoint, and generally has pain throughout the day as opposed to just when you utilize the tendon. Tendinosis means it's been lingering on for a long period of time, and only discomfort usually comes about when you're actually using the tendon. Now, the easiest way to think about addressing this issue is viewing it as a math equation. So it simply just means at one point in time or repetitively over an extended period of time, you have exceeded that tendon's capacity to withstand stress. In which case, the math equation is out of balance. The stress to the patellar tendon is exceeding the capacity of that patellar tendon's capability to withstand stress. Now, the common adage from some generalized rehabilitation clinic or some generalized doctor is going to tell you just to rest. Now, all that's going to do is decrease the stress of the tendon, which might make it feel a little bit better for a period of time, but then when you go back to using that tendon and stressing that tendon with things such as sports, basketball, football, volleyball, lifting, those are stressors to the patellar tendon. And if you never did anything to reestablish the capacity of the patellar tendon in the first place, then that's why you're always going to experience pain. The other thing that generalized doctors and generalized clinicians do not tell you is that when you injured a piece of tissue and you experience pain, that means there is a moment of compromise to that tissue, meaning the capacity of that tissue has been lowered, which also means it's much easier to exceed that threshold of capacity of what that tissue is currently capable of doing. So every time you push into a flare-up that sets you back for a couple days, you are lowering your capacity down lower and lower and lower, which is why it becomes easier and easier and easier to re-injure your tendon. This is why we talk about lifting at your current pain-free ability, as well as playing and doing dynamic activities or practices at your current pain-free level. This might change day to day and week to week, but this is why it's important that you don't push yourself to exceed what that capacity of that tendon is ultimately capable of doing at this moment in time. Now, how do we fix this issue for good so you don't ever have to think about or be worried about some theoretical capacity limit that your tendon is capable of doing? We don't want you feeling injury prone. We don't want you feeling broken. What we want you to feel is confident, resilient, and ultimately athletic if that's your goal, is to play athletics. So in order to do this, we focus on building capacity up at your current pain-free level. Things that will be important for you to consider are strengthening that tendon through a full range of motion. Now, what is generally easiest to start is strengthening through a partial range of motion, or potentially even an isometric to start off. This generally is the more comfortable way of approaching the tendon to build some more capacity, build some more strength and endurance with higher rep ranges. And then ultimately, as the tendon desensitizes and the capacity of that tendon improves, then we start strengthening through a full range of motion. So if you only strengthen the top of the movement for a squat, for an example, or a partial range of motion squat, then your tendon's only going to have capacity within that range of motion, meaning anytime you go lower or deeper into that position of a squat, your potential risk for injury or setting that math equation off, so that anytime you go deep down into a squat, now you're exponentially increasing the amount of risk that a potential re-injury could occur because you've never exposed the tendon to that position, you've never built capacity of the tendon in that position. Secondary to that, research is actually showing that the full range of motion squat is actually what builds the most hypertrophy in the muscle tissue itself, meaning the size of that tissue in the muscle. So we're thinking about bulletproofing the body to where you don't necessarily have to worry about an injury occurring again and being confident in your capability. Then we want that tendon to be super thick, super strong, and very, very dense. And the only way of doing that, and again, this has been shown through research to be done in the most effective manner, is through full range of motion strengthening. And finally, the third biggest component of this, especially for athletes, to restore the capability of moving quickly, moving athletically, we need to develop the elastic qualities of that tendon. Now, this is where a lot of people will skip to this point in time way too quickly, because ultimately these exercises are more fun, but also they tend to relate to athletics and sports performance a lot more too. So people are trying to push the limits of these capabilities a lot of times way too quickly. And again, if you do this too quickly, then you're going to throw this math equation out of balance again, where you're going to exceed the capacity of your tendon, and you're going to ultimately result in having pain and a flare-up happening again. So we need to spend ample amount of time in the building phases of building strength in those shortened positions, those isometric positions, those lengthened positions, and ultimately build hypertrophy in tendon size and hypertrophy in those positions, so that you can tolerate the plyometrics and the elastic exercises much more safely. And ultimately, this builds you a bigger foundation of tissue resiliency that allows you to exercise and practice more frequently without the risk of getting injured. So you always need to be thinking about building tendon capacity through a full range of motion, through those partial ranges of motion, developing that tendon capacity through strength endurance, strength power, ultimately developing that tendon capacity so it can withstand the demands of plyometrics in sporting activities. If you jump too quickly to plyometrics and elastic component and elasticity training, you're going to wind up continually injuring the issue over and over again. And this is what I see all too often, is the moment in time someone starts feeling better, they get right back into plyometric training, or right back into dunk training, or right back into their sport full speed ahead, or doing a combination of all three: strength training, plyometric training, and practicing for their high school team and then practicing for their AAU team. Again, there's just way too much volume that your tendon is not capable and ready for. So this is another important reason why you need to spend more time and emphasis on those beginning phases and trust the process. Trusting the process is easier said than done, but that's why, again, having someone who's been there, done that, and helped somebody with these issues out many times before becomes useful. So if you don't have somebody in your nearby area that you trust and find helpful, you can email me at greg@sportsrehabexpert.com, and we can talk about how we can put a game plan together for you at a distance and ultimately get you back into the things that you enjoy doing.